Hey everyone, welcome back to all my listeners. This is episode number 10 of my 10th season. Today is Wednesday, November 8th, 2023. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, you guys, today is the second Wednesday of the month, so I'm going to be getting into the October 2023 OIG Work Plan in today's Newsworthy. And there are 7 work plan updates. And we finally have a new CBR that's just being mailed out. So Trusty Tip unpacks all the details and more in the latest comparative billing report for initial nursing facility E&M visits. And of course, I'm going to go ahead and close out and round out today's episode with the remarkable quote on perseverance by the famous Brazilian football phenomenon, Pelé. Let's get into it. Whether you are involved in the business of healthcare or any other business, what do you, your teams, and your management concentrate on the most? Typically, they communicate, problem solve, and make strategic decisions that drive the success of the organization. But how much time is actually spent in making tomorrow better than today? Are they striving for operational excellence? Prevention versus correction is a concept that's been known for years. So why do so many companies not implement the process? Utilization Management University provides a course that proves to be a unique solution to instill change in the mindset of business teams. This course provides the theory and the practical approach. This course will demonstrate how to implement a simple methodology as a solution. This course provides a detailed explanation of each and every step involved in prioritizing your problems and finding the root cause. This course shows how to engage team buy-in. This course readily provides available support for any issues. And the course provides the theory and helps you adapt it to your own individual circumstances. Check out the details at www.utilizationmanagementuniversity.com today and get registered. Utilization Management University, making tomorrow better. So let's get into Newsworthy, the month of October's OIG Work Plan updates. Now there are 7 updates to this month's OIG Work Plan. The first is titled Timeliness of Mental Health Care Following a Suicide Attempt or Intentional Self-Harm Incident for children enrolled in Medicaid. Now, this report is expected from the Office of Evaluation and Inspections. Rates of suicide attempts and intentional self-harm among youth are on the rise. A previous suicide attempt is the most important predictor of death by suicide, and the risk of death by suicide is highest in the period immediately after a hospitalization or emergency department visit for a suicide attempt or intentional self-harm incident. As such, providing timely mental health care follow-up is critical to decreasing the likelihood of rehospitalization and preventing suicide. The OIG will conduct an evaluation to assess whether children enrolled in Medicaid, as well as the Children's Health Insurance Program called CHIP, who had an emergency department visit or hospitalization for a suicide attempt or intentional self-harm incident, received mental health care follow-up within established timeframes. The OIG will also examine whether certain groups of children in our population were less likely to receive timely mental health care follow-up after a hospitalization or emergency department visit. Finally, the OIG will interview subject matter experts to identify the challenges and best practices that states encountered when working to ensure that youth enrolled in Medicaid and CHIP receive timely mental health follow-up care. This final report is expected in fiscal year 2025. Now, the second OIG Work Plan update is titled Mandatory Review of HHS Agency's Annual Accounting of National Drug Control Program Funds. Now, this report is coming from the Office of Audit Services. The National Drug Control Program Agency compliance reviews requires agencies expending funds on National Drug Control Program activities to submit an accounting of such funds made during the previous fiscal year. The policy also requires that an agency submit with its annual accounting an authentication provided by the agency's OIG that expresses a conclusion on the reliability of the agency's assertions. The Office of National Drug Control Policy Circular states that if in an agency's prior year drug-related obligations were less than $50 million, the agency would not be subject to these authentication requirements. The OIG will review how HHS agencies complied with this circular and will submit the authentication with respect to the HHS agency's annual accounting, beginning with fiscal year 2020, once every 3 years. This final report is expected in fiscal year 2024. Now, the third OIG Work Plan update for October 2023 is titled Review of HHS Government Purchase, Travel, and Integrated Charge Card Programs. This report is expected from the Office of Audit Services. The Government Charge Card Abuse Prevention Act of 2012, the Charge Card Act, requires inspectors general, or IGs, to conduct periodic risk assessments of their agency's charge card programs to analyze the risks of illegal, improper, or erroneous purchases. The Charge Card Act requires IGs to use the risk assessments to determine the necessary scope, frequency, the number of IG audits or reviews of the charge card programs. It requires federal agencies to establish and maintain safeguards and internal controls for purchase cards, convenience checks, travel cards, and integrated cards. The Office of Management and Budget has instructed IGs to submit annual status reports on purchase and travel card audit recommendations beginning January 31st, 2014, for compilation and transmission to Congress and the Government Accountability Office, the GAO. The OIG will review HHS's charge card programs, i.e., for purchase, for travel, or for integrated cards, to assess the risks of illegal, improper, or erroneous purchases. HHS's charge card programs enable cardholders to pay for commercial goods, services, and travel expenses. This final report is expected in fiscal year 2024. Now, the fourth OIG Work Plan update for October 2023 is titled Audit of Efforts of State Agencies to Ensure the Safety of Children in Foster Care. This report is coming from the Office of Audit Services. The Federal Foster Care Program, which is administered at the federal level by the Administration for Children and Families, helps states provide safe and stable out-of-home care for children. The OIG plans to conduct 2 nationwide audits that focus on related aspects of state agencies' efforts to ensure the safety of children in foster care placements. The first audit will examine the state's use of temporary emergency placements not designed to house children, such as hotels or offices, when a permanent placement is unavailable. And the second audit will determine whether critical incidents involving serious physical injury or sexual abuse to a child in foster care are being reported in accordance with state and federal requirements. Both of these final reports are expected in fiscal year 2025. Now, the fifth OIG Work Plan update for October 2023 is titled National Snapshot of Recent Trends in the Refugee Resettlement Program. This report is coming from the Office of Audit Services. Under the Refugee Resettlement Program, the Administration for Children and Families, as well as the Office of Refugee Resettlement, or the ORR, provides funding for benefits and services to facilitate the successful resettlement in the United States of refugees and other eligible individuals, as well as to help them attain self-sufficiency. These benefits and services include cash, medical assistance, employment services, and childcare. The number of refugees needing assistance has been the highest in several decades, which there has already been an increased cost of and challenges to assisting individuals in achieving self-sufficiency. The OIG will examine 3 things. The first, they will summarize nationwide data on ORR's refugee resettlement program from October 1st, 2020 through December 31st, 2022. Second, the OIG will identify recent trends in program participation and outcomes. And finally, third, the OIG will identify any challenges encountered by organizations funded to administer the Refugee Resettlement Program. This final report is expected in fiscal year 2025. The sixth OIG Work Plan for October 2023 is titled Audit of Accuracy of CCDF Attendance Records at Minnesota Child Care Centers. This report is coming from the Office of Audit Services. Reauthorized in the Child Care and Development Block Grant Act of 2014, the Child Care and Development Fund, the CCDF, is the primary federal funding source devoted to subsidizing the child care expenditures of low-income families. Prior OIG audit work identified issues with the completeness and accuracy of child care attendance records and with related billings for child care services. Using a risk-based approach, the OIG plans to select Minnesota and possibly additional states for a review to determine whether the states complied with federal and state requirements as related to attendance records and whether payments for services at child care centers were allowable. This final report is expected in fiscal year 2024. And the seventh and final OIG Work Plan update for October 2023 is titled Audit of Morehouse School of Medicine's National Infrastructure of Mitigating the Impact of COVID-19 Initiative. This report is coming from the Office of Audit Services. The National Infrastructure for Mitigating the Impact of COVID-19, the NIMIC, initiative seeks to develop and coordinate a strategic and structured national network of national, state, territorial, tribal, and local public and community-based organizations that will mitigate the impact of COVID-19 on racial and ethnic minority, rural, and socially vulnerable populations. The NIMIC initiative is a 3-year, $40 million cooperative agreement between HHS's Office of Minority Health as well as the Morehouse School of Medicine to fight COVID-19 in racial and ethnic minority, rural, and socially vulnerable communities. The Morehouse School of Medicine is leading the initiative to coordinate a strategic network to deliver COVID-19 related information to communities hardest hit by the pandemic. The NIMIC initiative is expected to result in, number one, improving the reach of COVID-19 related public health messaging to racial and ethnic minority, rural, and socially vulnerable populations. The NIMC initiative is also expected to result in increasing connections to healthcare and social services for racial and ethnic minority, rural, and socially vulnerable populations. It's also expected to result in decreasing the disparities in COVID-19 testing and vaccination rates among racial and ethnic minority populations in highly impacted geographic areas. And finally, fourth, the initiative is also expected to result in enhancing state, territorial, and tribal capacities and infrastructures to support response, recovery, and resilience among racial and ethnic minority, rural, and socially vulnerable populations. The OIG intends to determine which strategies the Morehouse School of Medicine implemented to achieve the goals of the NIMIC initiative and whether the Morehouse School of Medicine met the project goals and complied with federal regulations. This final report is expected in fiscal year 2024. And now it's time for my best practice tips in Trusty Tip. So in today's compliance tip, let's get into the latest comparative billing report on initial nursing facility evaluation and management visits. Now, this is CBR number 202309. That's right, this is the 9th CBR for the year for 2023. Right now, CMS is going to be issuing a comparative billing report, that CBR, to rendering providers that submitted claims for Medicare Part B initial nursing facility E&M visits. Now, the CBR number 202309 focuses on Medicare Part B claims submitted with CPT codes 99304, 99305, and 99306. The CBR analysis was based on claims extracted from the Integrated Data Repository using the very latest version of claims available on August 29, 2023. And this analysis includes paid claims with dates of service for 1 full year, from January 1st, 2022 through December 31st, 2022. The 2022 Medicare Fee-for-Service Supplemental Improper Payment Data Report reflects a projected improper payment rate, I hope you're all sitting, 13% of nursing home visits, which represents over $251 million in projected improper payments. Now, the types of error that comprise the improper payment rate for nursing home visits include, again, a whopping 67.7% improper payment rate that's been attributed to incorrect coding, and a 23.8% improper payment rate that's been attributed to insufficient documentation. After reviewing and researching the improper payment rate, this CBR was created to analyze the possible threat to the Medicare Trust Fund associated with initial nursing facility E&M visits. Now, the expectation is that rendering providers of initial nursing facility E&M visits will maintain proper coding documentation and confirm the appropriate use of CPT codes. Now, the criteria for receiving a CBR are that a provider is, number one, significantly higher compared to either state or national percentages in the metric calculations, which means they've been found to be greater than or equal to the 90th percentile. And number two, they've had at least 40 beneficiaries with claims for CPT codes 99304, 99305, and 99306. And finally, third, the criteria is they would have had at least $7,000 in total allowed charges. So let's dive into those CPT codes that are in the spotlight for this 9th CBR. Let's start with CPT code 99304. That's defined as initial nursing facility care per day for the evaluation and management of a patient, which requires these three components. Number one, a detailed or comprehensive history. Number two, a detailed or comprehensive examination. And number three, the medical decision-making that is straightforward or of low complexity. Further, usually the problems requiring admission are of low severity, or typically 25 minutes are spent at the bedside and on the patient's facility floor or their unit. Moving on. CPT code 99305 is defined as initial nursing facility care per day for the evaluation and management of a patient, which requires these three components. Number one, a comprehensive history. Number two, a comprehensive examination. And number three, a medical decision-making that is of moderate complexity. Further, usually the problems requiring admission are of moderate severity. Typically, 35 minutes are spent at the bedside on the patient's facility floor or unit. And finally, CPT code 99306 is defined as initial nursing facility care per day for the evaluation and management of a patient, which requires these three key components. Number one, a comprehensive history. Number two, a comprehensive examination. And finally, third, a medical decision-making of high complexity. Further, usually the problems requiring admission are of high severity. Typically, 45 minutes are spent at the bedside and on the patient's facility floor or unit. Now, the metrics involved in this CBR includes, number one, the average weighted services billed per day. Number two, the percentage of beneficiaries with more than one allowed service. And finally, third, the percentage of Medicare Part B allowed amount submitted for initial nursing facility E&M visits. So the CBR goes further and analyzes the rendering providers that submitted claims for initial nursing facility E&M visits using those CPT codes 99304, 99305, and 99306. And statistics were calculated for each provider, all providers in the state, and all providers in the nation. Now, the CBR number 202309 discloses even more details, that there were 38,834 rendering providers nationwide that submitted Medicare Part B claims for initial nursing facility E&M visits. Now, the total allowed charges for these claims were over $347 million during the analysis timeframe. Again, that one full year. And be mindful and remember the vulnerability for initial nursing facility E&M visits, right? Because according to that 2022 Medicare Fee-for-Service Supplemental Improper Payment Data Report, there is a whopping 13% improper payment rate for nursing home visits, which represents over $251 million in potential improper payments. And be mindful again, don't forget the types of errors they siphon down further that comprise the total improper payment rate, right? Include 67.7% is attributed to incorrect coding, and 23.8% is contributed to insufficient documentation. Now, the desired behavior here for our initial nursing facility E&M visits is to, of course, protect the Medicare Trust Fund. It's also for helping to reduce the possibility of improper payments by taking the following actions. Our providers can do these two things: review your CPT codes to ensure correct code assignment, and providers can also perform regular internal reviews of documentation and code selection to ensure accuracy and compliance. Now, it's critical to understand that a CBR does not indicate that you're going to get an official audit. Although, please be mindful that this phrase is directly coming from the MACs that issue the CBRs. So take that with plenty of grains of salt. More directly, consider this CBR to be your notice, your warning that you are most certainly being looked at closely. But the value of the CBR to providers is also great. It serves as a tool to look at your billing patterns as compared to your peers in your state as well as across the nation. The value also includes the fact that specific coding guidelines and billing information will be detailed. The CBR informs providers whose billing patterns differ from those of their peers. Now, my best practice recommendations always include, right, to review your CPT code definitions to ensure correct code assignment. Perform those regular internal reviews of documentation and code selection to ensure accuracy and compliance, because these two steps alone can help reduce the possibility of improper payments, right? Remember, there's that whopping 67.7% that was attributed to incorrect coding here, and then another 23.8% that was attributed to insufficient documentation. So both of these percentages are way too high in my opinion. So the CBR should have all of us providing initial nursing facility E&M visits really buckle down and self-audit whether we received this CBR in the mail or not. It's simply a great time to dive deeper into your own data, help yourself, and help the Medicare Trust Fund at the same time. You should really be paying attention to what you're sending out the door. Stay ahead of the curve and avoid receiving post-payment audits from the payers down the road, because it's fundamental, if you have Medicare as a payer, to keep your eye on correct and compliant coding and billing practices and make sure that you're adhering to all of them. And remember, this CBR is for 2022. You will need to be mindful and continue staying abreast of your internal self-audits in 2023 as well, because those new 2023 E&M guidelines for initial nursing facility E&M visits took effect, right? A better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, I focus Season 10 Spark on perseverance. I want this 10th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for perseverance in all we strive to do. So, in this week's inspiring quote in Spark is from footballer Pelé. Success is no accident. It is hard work, perseverance, learning, studying, sacrifice, and most of all, love of what you're doing or learning to do. Absolutely true, right? This quote reminds us that we don't just wake up one day with success. This quote reminds us that we wake up successful, knowing that we've worked hard, we've persevered, we've learned, we've studied, and we've loved what we've done. This quote encourages us to look at perseverance as something we do every day to push ourselves towards success. I'm happy Pelé's spark still burns brightly in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Thanks go to the sponsor of today's episode, Utilization Management University, making tomorrow better. So in my final note today, I still can't believe the month of October is just gone. It just blew on by. I hope you guys are getting a chance to still see some autumn colors here and there, and you're buying that discount candy, that Halloween candy. I know I am. But wait, I tried, but they've already taken the Halloween candy out and set up for Christmas. So I guess I missed my shot there. Anyways, Thanksgiving is always forgotten, and I am reminded of that every single year. It just goes straight from Halloween to Christmas up here in the Chicagoland area. I don't know if it's the same everywhere, but it's definitely like that here. Anyways, you guys, wishing you all an amazing and very happy week ahead. Thank you so much for listening on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.